Hi, and welcome to the Crunchy OB. My name is Dr. Michelle Aristizabal, and I am an integrative obstetrician in Scottsdale, Arizona. I am also the author of Natural Labor and Birth, an evidence-based guide to the natural birth plan. I have over 10 years of experience helping women have lower intervention births and unmedicated births. Please note that the information in today's video is just for informational purposes only, and please don't take it as medical advice. Always talk to your provider regarding any medical decisions, which is actually the point of today's video. Today, we're going to be talking about birth plans. People will often ask me, do I really need a birth plan? Should I have a birth plan? For those who don't know, a birth plan is a list of what you do and do not want during your labor process, and they're most commonly written by patients who are planning to deliver in the hospital. So, why the question? What's wrong with having a birth plan? Well, birth plans have kind of gotten a bad rap lately. A lot of people say that birth plans are unnecessary, they're a waste of time because birth itself is unpredictable and you can't possibly plan for it. Patients might worry that making a birth plan will make them seem unreasonable or difficult or make their doctor or their nurse not like them. And that fear is not necessarily unfounded. Just take a look at what the internet has to say about birth plans, mocking them, basically implying that patients who have birth plans have a one-way ticket to the OR for a C-section. And I have observed many members of the medical community mocking their own patients with birth plans in a similar fashion. At one hospital where I worked, they used to list it on the labor board as a patient risk factor. The other reason I think every woman should have a birth plan is because you may not be aware of it, but your doctor, midwife, or the nursing staff at the hospital probably already has a birth plan in mind for you, and that is the conventional medical birth plan. If you don't tell them what you want, then their plan is typically what's going to happen. For example, your doctor or midwife may have a plan for when you'll deliver, be that 39, 40, 41, or 42 weeks, and will plan to induce you if you do not labor by that point. If you've had a previous cesarean, they may have a time in mind when they'll schedule a C-section if you haven't labored. When you do come to the hospital, most commonly you'll be automatically placed on continuous fetal heart rate monitoring, a device that limits your ability to move about the room because the wire connecting you to the machine is only about 5 feet long. They might have mobile monitors, but if you don't ask for that, then they might not volunteer them because between you and me, they're kind of a pain to set up. You may not also be counseled that continuous monitoring, while excellent for detecting fetal distress, it also increases your risk of cesarean through false alarms. You may not be told that there's an alternative option of intermittent auscultation and whether or not you're a good candidate for it. Depending on how high your hospital's epidural rate is, they might just assume that that's what you'll want to do for pain management during labor. For example, at my hospital, 90% of women receive an epidural. So, of course, the nurses think that's what most patients are going to want. And when they come in labor, they start placing an IV, giving them IV fluids in preparation for that. Alternatively, if your doctor or midwife has a lot of patients that don't typically ask for an epidural, then the staff might not know that that's what you want if you want one, and your process of getting an epidural might be delayed. If you haven't made proper cervical change, your doctor may have a specific time frame that they'll typically perform a C-section. They might automatically start Pitocin or break your water. Medications such as antibiotic eye ointment or vitamin K are standardly given to your baby, and those are medications that if you didn't want, you'd have to refuse them rather than being asked for consent to give them. These are all the components of a typical conventional medical birth plan. So you see, there's a lot here beyond just, do I want an epidural or not? Or, I want to avoid a C-section. Please note, all of these interventions are not necessarily bad, and depending upon your risk factors and specific situation, they might be really great things for you in your labor. However, most patients do want an opportunity to discuss them. If your doctor or midwife is unwilling to have that conversation, if they're unwilling to discuss your care plan for labor and delivery and they manage all their patients the same way, then depending what you want for your labor, you might even want to think about having a different provider for your birth. But if you never told them, if you never talked about it with them, then you might never know how your provider feels about labor management. It's much better to find out at 28 weeks when you give your doctor your birth plan how they feel about things than to find out in the delivery room. Finally, another important reason that all patients should make a birth plan, and perhaps the most important reason, is that making a birth plan requires you to educate yourself about the labor process and common medical interventions. Informed consent requires an educated patient, and an educated patient is an empowered patient. Learning about labor also decreases fear and anxiety about the process, which actually improves the outcomes of labor and delivery. I highly recommend attending an organized childbirth education program such as hypnobirthing, hypnobabies, BirthWorks International, Birth Prep, and other conscious childbirth methods. Those tend to be my favorite. These utilize meditation as a coping strategy for childbirth, and they do a lot of education about optimal fetal positioning. You can also check out my book if you want in-depth information about natural childbirth plans. Until next time, let's make birth better and encourage birth plans.